Good afternoon, everyone. So, I'm Julian Balete. We are going to demonstrate the cranial nerve 1 to 6. So, cranial nerve 1, or we call olfactory. So, the assessment of the first cranial nerve, uh, or the factory nerve. Hypothermia, which diminishes smell, or anosmia, which is the absence of smell, disappear due to peripheral damage of the olfactory nerve. For example, because of the reminiscence trauma to the face or side effects of medication, or because of the central damage to the olfactory bulb or the olfactory nerve, um, tract, olfactory nerve only has a sensory. So the only sensory function, namely the detection of non-irritating odors. Some recommends to use common smells such as the coffee or vanilla. This is simple and reliable method, which is the alcohol sniff test, for which a 70% use that is available in most clinics and wards, and the familiar smell. So the patient is in standing or sitting position, and as the patient close her eyes, so close your eyes and keep shut one nostril. Is held shut as each nostril is tested separately. Hold the open alcohol pad under the patient's nose at a couple centimeters distance and ask the patient to identify the smell. Alcohol pad. And repeat the process with the other nostrils. Alcohol pad. The assessment method of the olfactory, the normal response is patient is able to identify the different smell with each nostrils and separately and with close her eyes. And then the abnormal response of the patient is hyposmia, is a reduced ability to detect odors. So, and then the anosmia is the complete inability to detect odors. In rare cases, someone to detect without a sense of smell, a condition called congenital anosmia. Cranial nerve 2, or we call optic nerve, is the second of the 12 cranial nerves at this part of the visual pathway. It can be damaged, damage due to intracranial hypertension or a variety of metabolic disorders by vasculitis and diseases such as MS. The optic nerves has a sensory and reflex function, namely visually acuity and papillary light reflex respectively. So in a test visual acuity with the um, with the help of Snellen chart or log mark. To start, patient stand 3 to 6 meters away from the chart. Depending on which is used, each eye is tested individually. So the patient covers their other eye with their hand if they use glasses or contact lenses. This should be worn during testing. During the testing, they read the letters on the chart out loud. And then
E F P P O Z L P E D P E C F D E D F C Z P.
in case uncontrolled acuity is less than 20/20, or the patient, you can use the pinhole test, or the patient needs reads through 2 millimeter the pinhole in a piece of cardboard, or spatial face to face to the patient, and ask the patient um, Which one of the fingers wiggly?
Normal response of optic is patient see things clearly in all quadrants of his or her visual field, and the abnormal response of optic, which is anopsia, is the absence of sight, and hemianopsia is partial blindness or a loss of sight in half of your visual field.
Cranial nerve 3, 4, and 6, which is the oculomotor, trochlear, and abducens nerves. The extraocular muscles impairs movement of the affected eyes and restricts its ability to gaze in a particular direction or directions. No diagnostic accuracy studies are available, so the clinical value is unknown. The examination starts with the pupils inspect the size, shape, and the symmetry of the pupils. The papillary light reflex is elicited by shining a light into the eyes and assesses the oculomotor nerve, which innervates the sphincter popula muscles. Constricting the pupil, shining a light into one eye should result in constricting of dead eyes pupil, called the direct response, as well as constriction of the other pupil, called the indirect response. Damage to oculomotor nerve results in absence of the light reflex.
Normal response of the oculomotor is the perla, which is the pupils equally round and reactive to light and accommodations. We have also the abnormal response, which is the mydriasis, when the pupils are fixed and dilated as blown pupil. We have also the miosis, is when the iris constricts to cause very small or pinpoint pupils. The anisocoria, mydriasis that affects only one eye.
Without moving the patient's head, ask patient to gaze in 6 directions: upward to the right, upward left, horizontally to the right, horizontally left, downward right, and downward left.
Normal response when both eyes are able to move as necessary, coordinated, and moves in unison with parallel alignment. The abnormal response is nystagmus, which is a condition in which the eyes makes repetitive, uncontrolled movements. Diplopia, the double vision of patients see two images of a single object. Bismus, which is the both eyes do not look at the same place and at the same time.
Trigeminal assessment method asks patient to close eyes and cotton ball and pins sequencing touch the different part of the face. The normal response, patient should identify the dull, which is the cotton ball, and the sharp, which is the pin sensation. The abnormal response, facial numbness, can be caused by Bell's palsy or stroke. If the patients look upward, lightly touch lateral sclera of eye. The normal response, patient will elicit blink reflex. And the abnormal response, piosis, is when the upper eyelid drops over the eye. And the trigeminal asks the patient to clench teeth while you palpate for the muscle tone. Ask the patient to hold the mouth open while you try to shut using your hand. The normal response, patient can resist pressure by opening his mouth. An abnormal response, lockjaw or trismus, refers to a disorder of the jaw muscles. Clinically, trismus refers to the limitation of jaw opening or mouth opening due to the muscular spasms.